everyone. We are here with Dr. Keith Starwalt. He is our Chief Clinical Officer at Evolve. Today we're going through the incredible benefits of peptides and how peptides can really help you recover from injury faster, better. So we're just going to get into it. And I want to start by asking Keith, what is peptide therapy? Because there may be some people out there who are a little confused at what the heck peptide therapy is. But that's why we're here to explain it. So take it away, Keith.
Sure. So we'll keep it really simple. So just to kind of describe what a peptide is, so we know what peptide therapies are, is that in the grand scheme of things, we have amino acids, peptides, and then proteins. So sorry, there's some feedback. I'm kind of hearing myself talk over and over again.
Oh,
So amino
too. Do you have your computer open?
Yeah, but I don't have anything recording, or I'm not watching it anywhere else.
Okay. I have my computer open, but I have it muted. I hear feedback too. So let me try to mute myself when you're talking.
That's fair. That's okay. Okay, can you hear me okay? Awesome. Okay, so just to kind of reiterate, Sean, you're funny. Peptides are small chains of amino acids. Usually, if we're being really specific, it's amino acids of 2 to 50. That's kind of the description. If somebody is in the peptide world, they have taken away some of the peptides and called them proteins and saying, well, we can't compound these anymore. We can't do this because it's not a quote unquote peptide. So again, just small chains of amino acids that make up proteins, and basically how they work in our body, regardless of whatever we're trying to achieve, is that they are signalers. They are signalers to do something. And what that something is usually turn on cells, turn on genes to do something positive in our body. I feel like that's kind of the most general way to describe peptides and peptide therapies.
Awesome. Are you still hearing the feedback?
No.
Okay, cool.
It sounds really good now. Oh,
I still hear
think it might be coming as I'm just chatting.
Yeah, I still hear it on my end. So, well, let's keep going. I will keep muting myself. So what are some peptides that are great for injury repair?
So there are a few peptides that I really like to use for injury repair, specifically TB500, BPC157, and we can probably touch on the growth hormone peptides as well, because they do play a role in cartilage production. And we'll start with BPC. I'm going to go on a rant. Okay, so just don't worry about what I'm going to say. BPC157. Both BPC157, TB500, discovered in the 80s and 90s. I think TB500 was originally used for horses back in the day. BPC157, discovered from human gastric juices. Where they come into play with injury repair is that they're very applicable for tendon repair, ligament repair, connective tissue, bone repair, muscle repair. So the things that I'll probably rattle off are very applicable for BPC as well as TB500. I will explain why there's a little bit difference, and you might go one way if you're trying to achieve maybe some muscle repair, or you might go another way if you're trying to achieve tendon, ligament repair. But overall, they decrease inflammation. If anybody's aware of the signalers, they're kind of called chemokines or cytokines, tumor necrosis factor A, TNF alpha, and IL-6. So those are the two bad ones we're always thinking about when we have inflammation. So those kind of get downplayed. There is something called VEGF, which promotes angiogenesis. So creation of blood vessels. So blood flow, very important for injury repair. Flushes the area, regardless if it's a shoulder, knee, hip, ankle, back, flushes the area with nutrients, increased blood flow, along with nitric oxide production. So we always think about nitric oxide vasodilating our blood vessels, getting more blood flow to an area. That's why bodybuilders love to pump. We got to get blood flow to the area. Those are kind of things that are very helpful when it comes to injury repair, along with other things like apoptosis, very scientific name. TB500 is really good with preventing cell death, helping promote cell proliferation. Something called tendon fibroblasts. Those are what create cartilage. So when we talk about tendons, ligaments, MCLs, ACLs, our cartilage in our knees, our joints, those are all comprised of a lot of cartilage. So chondrocytes make up cartilage. The TB500, BPC157, very helpful in recruitment of fibroblasts, which make cartilage. And that's just a huge thing where I use a lot for my patients, whether they're 25 or 105. They have ligaments, joints, you name it. These two peptides do really well in helping promote growth in those areas that have been injured.
Awesome. And I think the feedback stopped on my end. So let me know if it's good. But um, so, what kind of injury specifically can be prevented and also healed with the help of peptides?
So let's go with injury repair first. That is head to toe. Anything connective tissue wise, anything muscular wise, even nerve health, bone health, all are very applicable for both these peptides. The ones that I see most, I have a lot of, in my specific clinic, I have a lot of people coming in with pain. Whether they're athletes, because I do take care of high school athletes, college athletes, a few professional athletes. I see shoulder tendons issues. So we go specifically to the source, injecting both of those. It's a combination. We put them all in the same syringe and inject into the source. I see a lot of cartilage degradation in the knee. So I go into the knee joint, and as well as we get a lot of fractures. So we get runners who a lot of wear and tear on their feet. So metatarsals, whether it's ankle, calcaneus, or shin, we're doing injections to the close to the bone to help bone reabsorption. And if they have any tendonitis, very applicable for any of those issues as well. So repair wise, head to toe, it's very applicable head to toe. As for prevention, I think the BPC 157 as well as the TB500, very applicable for doing on a daily basis, every other day basis. As long in a week's time you're getting adequate medication, you can recover quicker, recover easier. You can train harder. Again, we're talking about athletes, but also just the regular leisure person who likes to go to the gym, who likes to be active, maybe like to put a few miles on their feet, lift weights. It's very applicable across the board. Again, 25 through 105 works very well for everybody, preventative wise as well as injury.
Awesome. Thank you, Keith. I do see we have a question in the chat. So, what determines which you prescribe TB500 versus BPC157?
Great question. So I would say, again, whenever I was describing both of them, they're very applicable for a lot of injuries. But if there's one that I'm going to say kind of edges out the other, is TB500 does have better action on muscles. So when we talk about muscle strains, muscle tears, muscle injuries, TB500 acts on a protein called actin. For those physiology gurus out there, actin and myosin make up the fibers of our muscles. So if we're doing contraction and relaxation, actin and myosin go along with this. So actin plays a huge role in muscle structure. So if there's a muscular injury, I always push a little bit to uh, TB500. If it's on a regular basis that somebody is doing proactive, trying to prevent injuries, BPC 157 is really good. Both work really well on tendons, ligaments, connective tissue. But if somebody's like, I just want to use one versus the other, maybe the BPC 157 might edge out just a smidge tendons, ligaments, connective tissue. So if you're trying to discern which one would be best, I would say TB500 for muscles, possibly BPC 157 for those cartilage connective tissue type of injuries.
Thank you, Keith. What other peptides do you really like that you would recommend to people out there?
So in the realms of, let's go with recovery, in the realms of physical activity, I do like the growth hormone secretagogues. One of the favorite ones that I like is CJC 1295 with ipamorelin. I think it's a little bit better than Samorelin just because of the half-life. I feel it's a lot stronger. There's also a tesamorelin ipamorelin combination that's a little bit more if you want to shred some adipose tissue, some belly fat, because that's what it was originally created for. But any of those medications work really well with recovery, body composition, energy. I love the improved sleep, the improved deep sleep. I track my sleep on my watch, and I know it's not perfect because it goes by heart rate, but I do get deeper sleep whenever I am doing any of these growth hormone secretagogues. Even the first week, it's very evident, and it's not just me. I've had a lot of patients say this exact same thing. But not only with recovery, energy, it does upregulate the receptors on cartilage. Or receptors for growth hormone. Growth hormone very applicable on trying to improve and increase cartilage. That's why it's very popular for a lot of athletes. It can improve body composition. It can improve muscle protein synthesis. Downstream with IGF-1, but growth hormone receptors, a lot of solid signaling to cartilage. So I have my patients who have decreased cartilage. They're on their way to osteoarthritis. I do combination of growth hormone peptides along with trying to do the TB500, BPC 157. Downplays inflammation, helps upregulate cartilage production. It's hard to, this is a quote, grow grass on concrete, but if you catch it early, you can be preventative and you don't have to really do any surgery down the line. I see a lot of chronic patients, so being preventative works really well.
Yeah, have you actually seen people who have completely avoided surgery because of peptides?
100%. So in my clinic, I do peptides, I do PRP, I do stem cells. So there's a variety of things that I can play with and offer to my patients. But specifically peptides, it's cost effective. You don't have to have your blood drawn. If you are 70s, 80s, 90s, having your own blood drawn to use that is not ideal. So I try to use peptides as much as possible. Because again, it doesn't matter what your age is; these are very applicable. I've seen regrowth with bone, so I use them for a lot of stress fractures. So whether it's on your feet, your shins, hands, elbows, doing it consistently works really well. There's a lot of growth factors, a lot of signalers that it comes with the TB500, BPC 157. Helps so much trying to flood the area with signals in a positive way to upregulate tissue proliferation. I would say Fractures are really good, as well as I do ultrasounds on shoulders, so I can see how the cartilage, how the rotator cuff heals. Doing the peptides, seeing a before and after is crazy because when you're looking at healing times, tendons, ligaments, these connective tissue that are in our shoulder, our knees, our hips, they don't have great blood flow. So increasing blood flow, angiogenesis, VEGF, getting the right nutrients to that area plays a huge role in healing these areas that don't have great blood flow. So I've seen great results.
Awesome. Yeah, I know there's so many success stories that we could talk about probably for hours with peptides.
Mhm.
So I do want to stop for a minute to let everybody know who's watching that they can ask their questions in the chat. Dr. Keith is here and happy to answer whatever questions you might have. Also, I see that little count going up. So if you like what you're hearing here, if this is interesting, if it's helpful, please let us know. We plan to do more live streams like this in the future. So it's good to know that people are liking it out here and are interested in this content. So um, let's talk a little bit more, obviously, about peptides. How fast can someone expect to see peptides really helping them heal?
I would say day one. So I'm going to go with a kind of a regimen, and it may make more sense whenever I say day one. So I'm going to just give a hypothetical patient, just so it's a little easier to understand. And so, 30-year-old patient rolled his ankle playing basketball at the gym, comes in, um, and then I'm suggesting BBC 157, TB 500. Um, they have the medications. I give them to them. We send them to them because I'm speaking as an Evolve provider. So they have their medications there at home. They can inject. Again, we're trying to get this patient feeling as best we can back on their feet. No pun intended. As quick as possible. So they can inject twice a day. They can do this regimen for a solid week or two. So they're doing morning and nighttime injections of an appropriate dose. They can see day one, day two of decreased inflammation. Pain is lessened. They have better functionality. They can tolerate more activity without having discomfort. They can tolerate more activity without having swelling. So very quick seeing results. And I see that across the board with a lot of my patients whenever they do a really, I wouldn't say hardcore regimen, but not just doing like once a week injection and hoping for the best. So this is being really on it because a lot of our patients are wanting to be the best. That sounds really corny, be the best that they can be. So we try to give them all the tools, all the medications that they can achieve that.
Awesome. Do you see a lot of people that come in for peptide therapy? Are they athletes? Are they just regular normal people who are, dealing with chronic acute injuries? What's the kind of breakout there with the people you see that come to Evolve, or in your own practice even?
Wide variety of patients. And what I mean by I see 25 through 105, it's exactly it. We have young people, we have the aging adult, those wanting to continue to be healthy, fruitful, longevity wise. We have athletes, professional, not college. We have recreational. It's all walks of life. This is what I'm talking about today is not just applicable for the hardcore gym goer, the marathon runner. This is for mom and dad. This is for brother and sister. This is for neighbor. This is the 25-year-old, the 21-year-old. This is the 105-year-old, and all in between. There has nothing to do with age when it comes to peptides, because they're very safe. And again, not trying to contradict myself, there are not a lot of studies on human placebo studies, or not placebo studies, but the same things with testosterone. There was a, not to go off topic, but there's good literature about testosterone being very positive for both men and women. It's been FDA approved. Um, Peptides have not gotten there yet. That's what I'll say. Peptides have not gotten there yet, but they're making their way because a lot of these animal models have to be first, and there's great results with animal models. There are human trials currently going; they're just not published yet. So we're working our way there, but everything so far, great results. I'll say that, yeah, great results.
And I do see some chats I may have missed. So Myron here, he says, I am 70 going on 50, but still 70. Any advice you can give me for my workouts, jogging, biking, and spinning?
Um, Vaguely, this is what I'll say is that nutrition has to be key. You know, we are what we eat, so we cannot put in McDonald's and expect to feel like a Greek god. Sleep is imperative, and that's where certain peptides can help get you there if you're having troubles with sleep. We are, as a society, very stressed. Cortisol is rampant with a lot of people, so trying to get adequate sleep is tough. That's where, you know, chatting with an involved provider who kind of knows the ins and outs of whether you're physically active, not physically active. You have XYZ disease processes. It's very helpful to talk to a provider to get a better understanding on what's troubling you, what can we do to help you, and to actually have a good game plan rather than say, here's your medications, good luck. Because that's not what we do at Evolve. We have a very good relationship with all our patients. And I think that makes us stand out a lot over these, you know, random clinics that you might find online. But going more onto the answers, sleep, diet, exercise. So if you want to exercise, doing peptides can help you recover better. So you can be in the gym, you can run and recover better. If you're not exercising, we want you to exercise. Being active really helps the aging adult um, age gracefully. Probably, and then anything other specific, I'd have to just talk to the individual to really hone in on, you know, what their goals are and what we can do to help them.
Perfect. Um, let's see. I have a peptides question here that just came in. Can peptides help a shoulder that's already bone on bone?
So it goes back to my comment about it's very hard to grow grass on concrete, meaning it's hard to rebuild cartilage if because it sounds like there's been wear and tear, so osteoarthritis or rheumatoid arthritis. You've lost a lot of cartilage. What peptides can do is help decrease the inflammation. Let's just say it's the knee. We're all human, so we all have to walk. We have to do normal daily activities. So if your knee, because there should be cartilage in between your knee joint. So if you're bone on bone, there's just a lot of friction. A lot of friction meaning inflammation. A lot of signals to your body. So it's going to be swollen. The peptides can help downplay pain, help downplay or decrease those inflammation markers. So you can probably go day to day feeling a little bit more comfortable, more functional. But as for growing cartilage, not a miracle or peptide. It works really well, but whenever there's no cartilage there, it's very hard to regain cartilage.
Awesome. Thank you. And for people just joining, if you have any questions, you can ask in the chat. If you like what we're talking about peptide therapy, injury repair, all of that, anything on that topic, ask a question about. Go ahead and tap that like button. Any likes help to bring this to wider audiences, let more people see what we're talking about today. And as I'm saying that, I see a question that came in. What peptide is good for daily training maintenance? Do you recommend BPC for someone who is training daily or a different peptide?
Yeah, I mentioned this briefly earlier, is that I think the BPC 157 is really good for somebody who likes to train daily, whether it's weightlifting, whether it's cardiovascular health, you're putting miles on your feet. Um, the BPC, not not that I'm here to give any like this is what you need to do, but daily regimen, or you can do every other day. What they kind of recommend is 400 to 600 micrograms daily. You know, you can definitely split that up dose wise. So you can do morning and night, or you can just do it once a day. But trying to get that medication in on a regular basis helps really well, helps with recovery really well. Um, so you're able to train harder, you're able to train more frequently, and we see that with a lot of our athletes. They can do more, they can put more volume, they can put more load, whether it's more reps, more weight. They're just able to tolerate more. Again, with weightlifting, or they're able to tolerate more miles on their legs. So one of either one of them would be very helpful.
Great. And Connor's asking, will peptides crash my natural hormone production?
It will not. So I think a lot of times, and I have this conversation frequently, the BBC 157, TB 500 will not affect like a negative feedback loop of anything. You're not gonna downplay. You're not gonna decrease any of these specific hormones. Maybe one thing or one area where people have questions about is growth hormone peptides. And the way I like to explain it is that we're not replacing your growth hormone. We're just maximizing your body's ability to make and secrete growth hormone. And that's why I always suggest with the combination of like a CJC, that's one part of the equation, and like an ipamorelin. So a growth hormone releasing peptide. You need really both because you can make a lot of growth hormone, but if somatostatin is in there putting the roadblocks, then it's hard to secrete. Um, but back to the question, it's not going to take over production. You're not replacing it. It's not the same thing as kind of testosterone. You're just maximizing your body's own ability. That's the one that a lot of questions I get asked about on affecting your body's natural production, and it doesn't. Peptides are very natural and healthy.
Great. And we also have another a question. Thoughts on the efficacy of NAD, glutathione, and I'm sorry, intranasally. Do you see that the chat?
I don't have the chat open. Maybe I can.
Okay. I think it might have been a
Oh,
mistype.
no, I see it. I see it. So I haven't looked too much into this. Um, my colleagues and I were in um, a seminar last winter, and an individual was talking about glutathione intranasally, specifically for brain health. So they're talking about Parkinson's. They were talking about Alzheimer's, and there was great absorption. Um, I usually thought NAD was a larger molecule where it had a hard time uh, breaching the blood-brain barrier, but he did a lot of studies for several years and said that there was good absorption, especially whenever they were taking samples, brain samples, blood samples from the brain, seeing that a huge uptake in glutathione, huge uptake in NAD levels after intranasal um, injections or sprays, I should say. So the fact that it's able to cross the blood-brain barrier is great. As for effectiveness, what I've only gotten what I heard from them is that great results with Alzheimer's, Parkinson's. But I like NAD and glutathione in general. So if it's able to cross the blood-brain barrier, I think as an anti-aging, as an antioxidant, as a mitochondrial health. That's huge. I don't know the exact numbers, but I've seen positive feedback from people who are studying it. So it's an interesting area. I want to know more about it, but I would say yes to somebody who's like, I'm interested in it. I would love to do this. I just don't know 100% about the efficacy, so I can't speak 100% about it.
And what would you suggest to someone out there listening that's dealing with an injury right now? What's the first thing you think they should do?
I would say, well, based on the injury, but I would recommend them probably contacting someone like Evolve, getting on a call, because you don't have to have a lab panel to do these peptides. You can just hop on a call like that, whoever's available for you, and speaking to somebody who has experience in helping somebody with injuries, helping somebody with recover injuries. No one wants to gimp around on a leg for 6, 8, 10, 12 weeks, or even more. Or shoulder, again, ligaments, tendons, they heal slowly. So if you're trying to get back to doing what you love, that is our main goal. We want you to be, quote unquote, bigger, faster, stronger, whenever you're done. Getting hold of us, getting the right medications, and then us helping them appropriately dose and appropriately apply the medications to them. That would be best case scenario, and not just wait around and see, oh, maybe it'll get better. We are not our 21-year-old selves, and even if you are 21, it there's no need to just wait it out. You can really maximize your time. You can minimize your time being injured, so you can maximize your activity levels afterwards.
Yeah, I think that's so key. You have to be proactive about this kind of stuff. You can't just let it fall
100%.
aside and believe that you're gonna, and you can really like speed up your recovery times with peptides. Have you seen examples of that in patients that we have?
Yeah, this might go to the person who just asked about
Oh,
a nerve injury. I'm going to answer. I'm going to answer his question along with other ones that I've showed. So several patients who have discompression. So what I mean by that is like your spine, a lot of nerves. So if we're looking at the spine right here, you have a lot of nerves from cervical to lumbar that go left and right of your body. When those are compressed, your nerves are compressed, and you have a lot of these random, vague symptoms of numbness, tingling, pain, loss of sensation, functionality issues. Those are kind of the general group. Doing injections specifically around these areas, again, it's tough if you're doing it yourself because it's hard to inject in your back. Um, I do this in my clinic and I have them lay down, but still very applicable for patients who have nerve issues, because it's not just the spine. You can do them near anything, whether it's elbows, it's wrists, it's ankles, knees, hips. Those are all very applicable places that you can inject yourselves. But when nerves are compressed and angry and have those weird sensations, you can inject BPC 157 near and around that area, supersaturate the area. Again, it's very helpful for nerve health, flooding the area with blood flow. Again, we're wanting to get good nutrients to the area. Decreases inflammation. So a lot of times when nerves are compressed, it's because there's inflammation around the nerve, compressing the nerve. If we can decrease the inflammation, we're relaxing the compression on the nerve, and then that's when neuropathy type of sensations kind of dissipate. They go away, they lessen. Again, the person feels better, they can be more functional, they're happier, and they don't have that lingering issue kind of affecting their daily lives. And I think that answers that person that might have said a low lumbar nerve root issue. You can go close to the source. And again, I would encourage you, if you're doing anything near the spine, to have somebody who's used to injections do it for you and not you just go about it yourself.
Yeah, what advice do you have to people, who are maybe a little nervous about actually injecting themselves with peptide? I know, like you make it really easy for patients somehow to actually do that and make it really simple. But um, what's kind of the key to doing that yourself?
No, that's valid question. I get asked that every day because there are a lot of people who are squeamish about needles.
Sure.
So I always, whether I'm online chatting with people, so this is the majority of the needles that we use. I mean, if you can see how thin and small that is, this is the smallest needle size that we can use. It's a 31 gauge. It is not daunting. It's very small. A lot of times when we're talking about, let's say you're doing maintenance stuff, you're not specifically going to injuries. So you're doing maybe a BPC 157 to the belly fat, or you're doing one of the growth hormone peptides, again, into the belly fat. You're just using a small needle like this. And what I usually do, and again, our PCCs are really good about helping our patients as well. So if I do it or if my PCC does it, um, they go everything from head to toe, meaning they do step 1 through 10, making sure our patients are very confident. They know how to withdraw medications. They know how to appropriately, pinch the belly fat, go in, whether it's 45, 90-degree angle, and you're not going to hurt anything. Everybody has a little bit fat. So even if I put this into my finger, I'm not going to hurt too much. I'm not going in very far at all. It only goes in 3/16 of an inch. So these are not daunting. These are not big. And you don't have to do them frequently. A lot of our peptide regimens are maybe daily, every other day. So it's very manageable. And then I think the rewards are way, way farther than what actually is how quote unquote scary a needle can be.
Yeah, absolutely. I mean, it's definitely worth the little poke you have to give yourself, getting the
For
benefit
sure.
and recovering. Um, so, do you have any stories in mind that you could share about fantastic recovery stories with peptides?
Yeah, I won't say names, but I do have a story, like fantastic story. So I'll just describe this patient, um, and then I'll kind of describe their start and what we did, and their finish or their functionality afterwards, and it kind of helps um, close the gap on what an appropriate treatment regimen is and functionality issues you can expect when doing these types of treatments. So, mid 30-year-old athlete, likes to work out in the gym, does some cardio, but not like a tremendous amount of running. Um, Developed some chondromalacia, so fancy word for a lot of degeneration in the knee. So if you're looking at the knee again, there should be cartilage in between the knee joint. There should be cartilage on top. There should be cartilage on bottom. Chondromalacia is kind of the degeneration of one or the other. That's just from overuse. So just being an athlete in the past, overuse. So explained how to give injections into the knee joint. It's very specific. I definitely would, again, if I was doing the same thing with one of our patients, I definitely would show them how to do it because it is not an easy thing. But they were confident enough to do it at home, so they did a specific regimen of BPC 157, TB 500. So they half dose of BPC, half dose of TB 500. They put it in the same syringe, and they did the twice a day dosing, morning and nighttime, for 2 weeks. And then they were feeling better, so we decreased the frequency, but we still did it every day. Did that for probably 2 months. Again, this is pretty severe chondromalacia, um, pretty significant wear and tear. This person was still being active. So as we were doing this, they're not putting on miles on their feet, but they are still compressing the joint. So whenever you squat, whenever you do a leg press, whenever you lift anything over your head, you do compress the joint. but that's very irritating if you have cartilage degradation or if you have wear and tear. So he's still doing activities. He's still irritating the area, but he was able to be a little bit more functional, especially first week. So that's key. First week of doing the regimen, able to be functional, not encouraged not to do certain movements like putting heavy loads doing squats. Not ideal whenever we're trying to address the specific situation because I'm pretty sure heavy squats, heavy presses are what got him in trouble to begin with. So he was able to kind of calm that down, but able to do everything else that he wanted to do. Fast forward probably 3 months because he did this single dose daily for 3 months. Was able just to cut off in general. Now he does maintenance, maybe every other day, maybe every 3 days of just BPC. Again, going back to what I said a while ago, is that is just good maintenance dosing. Very small amount every other day, every day. So that's what he just does now, and he's able to squat. He's able to do plyometrics, jumping without significant pain. Can actually bend his knee, do full knee bends. So that is a typical story, but then again, he put in the work. He did exactly whatever I said. He was to a T what he needed to do. Again, some of our patients are really religious and they're like, I'm going to do exactly what you tell me to do so I can be better, so I can do the things that I will want to do down the road, and I'm not just trying to live my best life for 10 years and then just be in a wheelchair from 50 on. We don't want that. Longevity for everybody. Living a fruitful life for everybody. That is my motto. That is probably one of a very good success story when it comes to how applicable peptides are, how fast we can really resolve issues, and then reaping the benefits down the road. He doesn't need to be doing this aggressive therapy for a year, 2 years, 3 years. He's able to do what he wants with just some maintenance medications or maintenance peptides.
That's a awesome story. So as we kind of wrap things up, I'm gonna do a call for last question. So if anybody has a question now, drop it in the chat. But Keith, I want to just give you a moment to add anything that we kind of missed that we might have glossed over. Um, the floor is yours for that.
Sure. So what I would say is that, and I'm not trying to deter anybody from doing these peptides, but again, there's not a clear consensus on who should not take them. And what I always encourage my patients, it's a shared decision, but I'm going to say for the BPC 157, for the TB 500, if you have I'm going to say this, and it sounds negative, but if you have a tumor or an active cancer, I really wouldn't want to give you these medications because they do upregulate cell proliferation. I don't want to feed anything. And again, I'm not pushing people away from these peptides because I prescribe them every day. I use them myself. I have my family use them, and they work really well. But always talking about good and bad. But if that is not an issue, if that's not in your health history, that's not in your family history, and again, even if it's in your family history, share a decision with your provider. These medications, these peptides work phenomenally. I wish I had these whenever I was younger because I definitely would have healed from a lot of injuries that I had to struggle with. So rolled my ankles, played college basketball, rolled my ankles regularly, and just lived in tape and ankle braces for a long time. My knees are not happy. And I think everybody can kind of, grab hold on, your body doesn't feel like it was when it was 21. So, if something's bothering you, if, you're not able to train as hard, you're not able to do all the activities that you normally like to do, I really would consider a BPC 157. I really would consider a TB 500, whether it's an old injury, very applicable. Just because it's been nagging for years, these peptides are very applicable for that. new injury, very applicable. You just want to recover better. Peptides are very helpful for that. So implore you to look more into it. Be your own advocate. Look at information. Ask questions. Um, I'm always open for questions. I love when patients actually ask me questions and they're not just a deer in a headlight and just absorbing everything I say. They're thinking for themselves and like, what about this? What about that? I absolutely love that because they're engaged. They want to know more because I can already tell they're interested and they want to hop on the train. They're just a little hesitant. Ask questions. Totally fair. Um, Wrapping it up. PPC 157, awesome. TB 500, really applicable. For muscles, probably TB 500. For everyday maintenance, or if you have a tendon injury, ligament injury, connective tissue injury, maybe the BPC 157. If you're looking for overall recovery, um, energy production, body composition, improved sleep, improved mood, I do like the growth hormone secretagogues. The one that we like to use is the CJC 1295 and ipamorelin, or the tesamorelin ipamorelin combination. So again, there are over 7,000 peptides. We just talked about maybe 3, maybe 4. So I'm assuming down the road we're going to talk about a whole slew of other, anti-aging, mitochondrial health, um, diet, weight loss. There's huge opportunities to grab hold of peptides that can really help you. It's not just injury. I know we just talked about injury stuff, but um, peptides are a newer medication and just very excited for what peptide future is. Very excited to help people with their issues, solving it with peptides. So again, ask questions, get a hold of your provider, get a hold of Evolve. That's what I would say. Get a hold of Evolve. Talk to one of our providers. They're all great, and just get started on some good peptide therapies for you.
Awesome. Well, we do have some final questions. Two of them
Sure.
just came from will BPC be effective for back if injected into love handle or stomach is the first one.
So how how I usually go about it is the BPC 157 or TB 500, whichever one you're using, works best if given at the source. It can have systemic effects because the idea is whenever you do in the belly, it's absorbed systemically and just goes where it needs to go. But I found that if you have a back issue, whether it's muscular, whether it's nerve related, getting close to the source is best case scenario. Um, but being said, uh, if you do like the sub-Q injection, it doesn't mean it's not going to help you.
Got it. And the second question from Tom was, can you swallow BPC in the injectable form for stomach? I
Can you
would.
say that again? I didn't hear you.
Can you swallow BPC in the injectable form for your stomach?
No, they actually make a oral pill, or an oral form, and because it was originally gathered from the human gastric juices, it has phenomenal um, healing properties for ulcers, ulcerative colitis, Crohn's, helps with acid reflux. That being said, when you do an oral route, it usually stays in the GI system, um, where it may not help like a musculoskeletal, a tendon issue like in your shoulder or knee. So that's again, depending on what your issue is. If you have a GI issue, the oral route is the best way to go. If you have a muscular skeletal tendon ligament issue, then the injectables are your best route.
Awesome. Okay. Well, cool. Thank you so much for joining us, Keith. Um, and if you do have any questions, anybody who's watching, you can contact our team. The website to go to is evolvetelemed.com. You can find that all on our YouTube channel. So if you were to subscribe, you will get updates of when we go live next, and all of the information you might want to know about peptides. So Thank you so much. I just see some last comments coming in. Evolve is an excellent company to work with, Neil says. Thank you, Neil. They've been extremely helpful and they have an incredibly knowledgeable staff. So that's a great note to end it on. And
Very much.
again, much for your time today, Keith.
Not a problem. It was a pleasure. Look forward to talking to everybody whenever they come in. I'm a open book, and again, look forward to helping everybody down the road.
Awesome. Thank you. See
All
you
right,
all soon.
guys, have a good one.